And finally, erectile dysfunction. Erectile dysfunction is common enough in middle-aged men and older, usually due to problems either with the vasculature or the nervous system. And so disease processes such as hypercholesterolemia, dyslipidemia, diabetes that damage the small blood vessels, the arterioles that supply blood to the corpus cavernosum, which is that part of the penis that becomes engorged during sexual excitement. If the small blood vessels are damaged, either by diabetes or high blood pressure or atherosclerosis that's damaging even larger vessels, then you may not have adequate blood flow. And the way that Viagra and Cialis and those medications work is by blocking an enzyme that leads to the catabolism, the degradation of actually a gas, nitrous oxide, which the body makes and which is necessary for that engorgement, for certain vessels to dilate, the vessels that supply the penis with blood, and then the returning vessels are relatively constricted, and so you have this effect. When an antidepressant causes erectile dysfunction, it's often linked with a decrease in desire. And so if we could improve libido, sometimes we improve the erectile dysfunction in an otherwise healthy individual. It's less common, or perhaps less commonly reported, but in those individuals who do notice a reduction in their sex drive and who are unable to climax, they do not complain of erectile dysfunction. Erectile dysfunction is not the problem. And it may be because there are medications that address that, there are devices that can also address that specific problem. And then the second broad category of pathophysiology that leads to erectile dysfunction over many years, and so we see it in middle age and beyond, is damage to the nervous system. The erection is a parasympathetic phenomenon. It is mediated by the parasympathetic nervous system. And so medications that tend to dampen the functioning of that system can have an adverse effect, can affect the strength of the erection. Specifically, adrenaline, which is a sympathomimetic. It's the sympathetic nervous system that is activated when you increase adrenaline or norepinephrine. Medications that do so can lead to erectile dysfunction. And cocaine, which also increases dopamine, which increases sex drive, but it increases also norepinephrine, noradrenaline very significantly, and the increase in the activation of the sympathetic nervous system by cocaine can often lead to erectile dysfunction. And the same is true of amphetamines, including Adderall, and really any medication that significantly increases noradrenaline.